Oh, hello there, everyone. It's Linda here from Just For Tummies. Thank you for joining me today. My guest today is Jane Bush, colon hydrotherapist. And the reason I wanted to speak to Jane today is because April is IBS Awareness Month, and it's also Bowel Cancer Awareness Month. And when it comes to managing the symptoms of IBS, in particular bloating and constipation, there is no better complementary therapy treatment than colon hydrotherapy. And Jane and I are going to explain to you why. Some of you have sent in questions that you want answering, and we'll cover those. We've got lots and lots of questions, lots of things to get through. So I really hope you enjoy today's live, and I hope that you learn something from it. And I hope if you've been contemplating having colon hydrotherapy, that today's live gives you the confidence to go ahead and book the treatment. If you think this video will help anyone else, then please do share it within your Facebook communities too. So without further ado, I'm going to invite Jane, and I'm going to let Jane introduce herself and explain why she became a colon hydrotherapist and what she loves about her craft. Hello,
Hi,
Jane.
Linda.
Hi there. Morning. Well, yes, just in the afternoon, isn't it? Anyway, have you been working this morning?
No, I've just been rushing around, hence I'm a bit rosy, I'm afraid. It's been sort of
Are you working later in the clinic?
I am, yes, I am.
Yes, yeah. So Jane, I've not given people, very much information about you. I mean, I will say that we've known each other many years now. Mm-hmm. And you are my colon hydrotherapist. I go to you for my colonic treatments. But if you can just tell people a little bit about you, your background in complementary therapy, how you became a colon hydrotherapist, and what you love about the therapy. Because I know you feel so passionate about it, as do I.
Oh, yes, definitely. So I've been doing colonics. This is my 8th year of colon hydrotherapy. And I'm based at Gedling Colonics in Gedling on Main Road. And my background was in musculoskeletal problems. So I was a remedial therapist prior to training with Arch.
Same as me, yes, remedial massage.
Remedial massage therapist. So I came across colonics quite a while ago, but it was something that I never knew where to go for. And one of my remedial clients put me on to Linda and gave me Linda's name. And at that time, I could have been sent anywhere. I didn't know about all of the training differences and things like that. And as a child, I struggled right from that age with constipation. And I can remember my mum having to sit me on the toilet for hours, chasing me around with glycerin suppositories and everything. And it's come down my family. So my mum struggled, my grandma struggled, and we do see it a lot in clinic.
Yeah.
And I just got to a stage where I was bloating horrendously after anything I ate. And I thought, and I was in a lot of pain, and I thought, right, this is getting silly now. I need to get it sorted. And hence, that's when I plucked the courage up to give our lovely Linda a ring. And since that, the rest was history. And because it's just changed my life so much, it was something that I was keen to pass on to other people as well. And it's just changed my life. I don't think... I know I wouldn't be here today. My stomach problems and everything were really, really bad. And as well.
And I have a similar story to you, don't I, Jane?
Yeah.
I mean, I was a remedial massage therapist, and I absolutely loved being a remedial massage therapist. But, for years since being a child, I suffered with a lazy bowel, with constipation. And it was only when I went to see a medical herbalist that she turned around and said to me, this is many, many years ago, and now she turned around to me and said, well, there's no point in doing anything, Linda, until we sort your bowels out, until you get rid
Yeah.
of your wastes on a daily basis. You need to
Yeah.
go and have colon hydrotherapy. And I
Mm.
said, colon what? I'd never even heard of it then. But she recommended an arch therapist to me who was in my hometown of all things, but I'd never come across her. And so I went to see her, and like you, it completely changed my life. And I knew there and then that as soon as I could, I would train in colon hydrotherapy and offer this wonderful treatment to other people who were struggling with constipation and with painful bloating. And yeah, the rest is history. Then you were one of my clients, weren't you? That's how we met. And I remember saying to you several times, Jane, look how it's helped you. You would make a great colon hydrotherapist. Go and train, and you did eventually.
You were right.
And I'm so pleased. I'm so pleased that you did, because you're a fantastic therapist. So I'm going to go through a little bit of the history, Jane, of colon hydrotherapy to explain to people. And then we'll go through some questions that people have raised.
Yeah, sure.
All right. So is that okay with you? Yes. Yeah.
Yeah.
I'm just going to see if I've got any questions. Just people saying hi. Oh, this is a nice one from Karen Clark. Hi, Karen. Thanks for watching. Jane, you changed my life, and don't know where I'd be without. Isn't that lovely?
Hi, Karen.
And we and other colon hydrotherapists have so many similar stories, don't we? And it does. I don't think people realize how life-changing colon hydrotherapy can be, and especially when it comes to people who suffer with chronic constipation. And we'll probably talk a little bit more about this later. But nothing else works as well as a colon hydrotherapy treatment when it's being performed by a practitioner who's been well trained and they know what they're doing.
Exactly. Yeah. It's
sorry,
so important to check the training. So important.
And I know, that people who have had colon hydrotherapy in the past, they have been saved from having to have bowel surgery and colostomy bags. Because they've been to see a colon hydrotherapist and it's sorted out their chronic constipation. So don't let anybody tell me that colon hydrotherapy, doesn't work and is not an effective treatment. So let's have a little look about the history of colon hydrotherapy, because I don't think people know that how far it goes back. Certainly not the equipment that we use nowadays in our clinic, Jane, the modern equipment that we use, but the practice of cleansing the bowels of impacted toxic poisonous waste material that's just sitting there. So colonic irrigations and enemas are amongst the oldest recorded medical treatments, with descriptions in the Egyptian Ebers papyrus dating back to 1500 BC. And I know in some civilizations, even before then, much longer, 4,000 years BC. And Hippocrates, he described using donkey milk, honey, and sweet wine from olives to perform enemas. And there are artifacts from South America that exist that describe blow enemas. So a blow enema, that's where they would maybe have some kind of implement. I know in Egypt they would use a reed, wouldn't they, Jane?
That's right.
They would use a hollowed out reed, and they would go down to a river or a lake bed, or they'd get the water from somewhere anyway, and they would suck the water up that reed, insert the tip into the rectum and blow the water in an attempt to soften that hardened feces and increase peristalsis. And that's been used. They were using reed enemas thousands and thousands of years ago. And then we know that in the Aramaic texts nearly 2,000 years ago, detailing the teachings of Jesus, how they emphasize the importance of internal cleansing, as do many other cultures.
Yeah, they do. They do.
So it's, as we came into the late 19th and 20th century, both conventional medics, doctors and naturopaths, so doctors like Arbuthnot Lane, who was doctor to Queen Victoria, Kellogg of Kellogg's fame, and Dr. John Tilden, they all promoted internal cleansing using enemas. And back then in Victorian times, they had quite elaborate equipment, didn't they, of getting water into the rectum.
Actually, I've got an old-fashioned enema here, a Victorian one.
Have you? Oh,
did you want to see it?
Yeah, I have somewhere as well. Let's see yours, Jean. I don't know where mine is. I don't know where I've put it.
So this is a Victorian enema which a client brought in for me in its box.
Yes.
And this is let me show you. This is the enema. So you had one bit that goes into the fluid or the water. The other bit is the speculum.
Yes.
And then we've got like a little bubble in the middle, which is like a pump, which they used to pump the water.
Like a bulb, yes.
Through. And this is an original from the Victorian times, and then it also has another speculum. Goes up. So yeah, this is.
I've got a similar one. And of course, back then in Victorian times, enemas were very popular. Yeah, doctors would regularly recommend and perform enemas on their patients. And I also read somewhere that, you know, back in those days, in Victorian times, you know, women wore a lot of clothing, didn't they? And you know, there wasn't access to toilets like we have nowadays. So if they were starting about promenading, as they say in Bridgerton, they got caught short, where would they go to have a bowel movement? So what they did, their doctor or maybe their maid would perform an enema on them so that they evacuated their bowel at the beginning of the day, so they could then go promenading without the risk of having an accident. You know, needing to go to the, I mean, where would they go to the toilet back then? I watched Bridgerton, I think they look so lovely, don't they? But you know, if you get caught short,
I know, it must have been a nightmare. It really must.
Anyway, carrying on. Right, so that's right. So it brings us up to the 1980s then, Jane, when equipment and machines were developed by Dr. Woods, the gravity method, which I use and which I know you use, then the machines made by Detolo, Transcom, ICHF, and I've put Hermany there. It's Herman, actually, HERMA. I think it's double N.
Yes, it is.
So the equipment now used, it's plumbed in, isn't it, Jane, by a professional plumber, and all the specular tubing is single use and it's disposable. So can you show us a kit then, please, Jane, and just talk us through the kit?
This is the kit that we use. We follow the NHS guidelines very closely, so everything is single use and disposable. So no risk of any cross-contamination. It's all sterile packed. And this is just what the speculum looks like, which we use. Now, don't let this frighten you, because only the top bit actually goes in, the top 1.5 to 2 inches. So yeah, this is the equipment that we actually use, and it's all disposable, so there's no risk of any cross-contamination at all.
Yes. And I always said to people, you know, when I showed them the speculum, and you know, I could see like the horror. Oh dear, that's big. And I say, well, look, what's coming out is usually bigger than the speculum that's going in.
Exactly.
Just look in the toilet after you've had a bowel move, and how, you know, it's got through the same hole, for goodness sake.
I always say it's very elastic down there, you know, it's fine. It's fine. It's like you say, more things come out.
Especially in women, it's more, you know, we are looser down there, aren't we? When we've had babies and when we've gone through the menopause as well. I'm just going to bring this question up that Facebook users, it's probably somebody on Tummy Talk that's posted this. Do you have to get a referral for this treatment, or can someone simply book themselves in? Well, Yeah.
No, you don't have to get any referrals. We do a very in-depth consultation with you on the first treatment and health background check. Obviously, there are people that we can't treat who show up what we call red flags. So we do check your health background, make sure that it's fit and you're safe for treatment. But apart from that, just get in touch. You can book yourself in. It's not a problem.
Yes, that's right. Just checking some more questions. So I just want to say to everyone, welcome to our live today. I'm here with colon hydrotherapist Jane Bush, and with it being IBS Awareness Month, we're talking about modern naturopathic colon hydrotherapy and how it can reduce the symptoms of IBS, in particular painful bloating, painful trapped gas, constipation. So if you've got any questions, people who are watching, please do comment below this video, and we'll get them answered for you. So right, back on to, where were we? Oh yes, this gets asked a lot, doesn't it, Jane?
It does.
What's the difference between a colonic and an enema? Do you want to explain?
Yeah, I mean, with an enema, we get this quite a lot with the nurses that come. I do that. I do what you do in the hospital, and it's not, because
No,
with
they
the
don't.
enema,
No, they don't.
it's not at all. With the enema, it only really releases the rectal area. With a high enema, you can get up towards the splenic side, which is the top left-hand corner, but that is a very high enema. With a colonic, we aim to get all the way round, all 5 foot of it, round to the cecal area. Now, that can't always be done in one treatment. It depends on how built up people are. So sometimes we get people coming back 2 or 3 times quite close together, so we can get everything out of the bowel. But the enema really is just the first bit of the bowel that we empty.
Yes. And I mean the enema, I did have an enema, but I don't know where I've put it. And the enema tip that's inserted into the rectum, it's literally about the width of your little finger, isn't it? And obviously with an enema, you can only get maybe 500 mils of water in at a time before you have to release it on the toilet. Where of course with a colonic, you're using is it about 60 litres on average, Jane?
I work usually around about 80 to 100 litres of water.
Yes, yeah.
I
think it depends what
not all in
bowel you're working on, doesn't it?
Yeah,
whether it's a short,
not
fast
all in
bowel, or a long, loopy, lazy bowel.
That's right. Yes,
because the latter would need more water, wouldn't they?
It would definitely. I was going to say something else about the enema then. With the enema, you have to physically hold it in as well. You have to retain it.
Yeah.
And I get this quite a lot with people who do home enemas. They come here for a colonic, and I say, no, it will do it all for you. You don't have to hold it in. You just relax and it will do it all for you. Yeah. And I think that's a lot easier for people as well, because it's that actual retaining which can get a bit painful sometimes. Especially if they've got
enemas. I think maybe enemas are okay between having colonics. For people that do suffer with constipation. So I think they do have a place.
Oh, definitely.
Enemas.
I've got clients that swear by them in between treatments, like you saw, Linda.
Yeah, I mean, I've used enemas on myself in the past, but Jane, just too much of a faff. I'd rather come to you for a colonic, to be honest. I'd rather you do it all, and I can just lie there and relax and check my messages on my phone.
You do.
I often get this asked as well. What's the difference between a colonoscopy and a colonic? Because very often someone will say to me, oh, couldn't possibly have a colonic. I had a colonoscopy and it was so painful. And I say, well, what makes you think that a colonic is going to be as painful as a colonoscopy? I mean, saying that about colonoscopies, Kevin, my husband, had a colonoscopy last year and he didn't have any pain relief whatsoever. He wanted to watch it on the big 4K screen in full colour. But I think maybe when it comes to colonoscopies, I'd be interested to know if there's any research that shows that women find a colonoscopy more uncomfortable than a man, because we know that as women age, and certainly women who have had abdominal surgery like hysterectomies, the bowel can prolapse into that space, and so maybe that can make it a bit more difficult for the scope to go through during a colonoscopy. But do you want to explain the main difference between a colonoscopy and a colonic?
Definitely. Yeah, I've had the same, Linda. I've had a few people ring up and think it's the same kind of feeling. But with a colonoscopy, where they're actually sending a probe around your bowel, so they have to be quite forceful in places to get it round the corners and round the loops. With a colonic, the speculum, the plastic tube that holds the anal area open, only goes up 1.5 inches. So all that's going into your bowel itself is pure, warm, filtered water. So we've got none of the actual hardware, anything hardware going into your bowel. So it's completely different to a colonoscopy. Probably the only similarity is the prep that you have before the colonoscopy to clear your bowel out.
Yes, that's right. Yes, the movie prep. Yes. Kevin had that. He tolerated it quite well. I think it was like a citrusy, lemony flavour, and I did taste it. I think quite pleasant. But then he had to drink an awful lot of it. But one thing with a colonoscopy as well, Jane, is they have to inflate the bowel with air.
They do, they do.
Prior to putting that scope in, and I think it's that maybe is the uncomfortable bit as well.
Yeah, I bet it is.
But I mean, for me, a colonoscopy, it is the gold standard procedure for taking a look inside the bowel, isn't it? And I mean, with Kevin, he started to have some rectal bleeding because of COVID. His fit test was delayed. The one that you get after the age of 60 every 2 years, and he noticed some rectal bleeding. And then his fit test came through. He sent it off, and it was very quickly, in and scheduled for a colonoscopy where they found a polyp that was bleeding, and they soon snipped that off and sorted that out. So
that's
I
good.
encourage
they
anyone.
Do move fast, don't they? If they need to, they do move fast.
Well, they were excellent where we live at Nottingham, Queen's Medical, the treatment centre there. And I don't want to go off on a tangent because I can easily do this, Jane. Anyone who gets their fit test, you're entered into the bowel cancer screening programme when you reach the age of 60. You get a kit through the post every 2 years, if you're registered with a GP, of course, to do that test. Because bowel cancer, if picked up early enough, is very treatable.
It's so important. It really
very
is.
important. Right, back to the questions. How long does the colonic treatment take, Jane?
So on initial treatments, when we have a good chat and consultation, you're with a colon hydrotherapist about 1.5 hours. So the consultation itself is around about half an hour, and we'll also talk through the procedure, go through the equipment with you, things like that. The actual treatment itself, you're usually on the couch for around about 35-45 minutes. Obviously we can't keep you on there for hours because we don't want to affect electrolyte levels or anything like that. And then we do sit you on the toilet at the end for at least a good 10 minutes, as long as it takes. It's a bit, we don't rush. So if there is any excess water in there, any more stool to come out, it's all taken out in the toilet, and you feel nice and comfortable. So you're really about 1.5 hours on the initial treatment.
And I was the same when I was in clinical practice, Jane, and it is so important to give people time, isn't it? You cannot rush a colon hydrotherapy treatment. And I know that when I've had when I've had clients on the couch, and as a colon hydrotherapist, we never leave our client's side, because we're obviously doing abdominal massage throughout the treatment. We're checking the water temperature. We may be, doing a herbal implant of some kind. We're always looking at our client's face and checking their body language, because we can soon pick up subtle changes when we know that they might be in a little bit of discomfort, but they may not tell us that. Okay. And I always used to say to people at the beginning of a colonic, look, if anything feels uncomfortable, anything that you're not sure about, just say so. If you feel as though, if you can feel a little bit of cramping, or you feel as though you need to go to the toilet, let me know. I can whip this speculum out in 2 seconds, and you can go and sit on the loo, and then you can come back and we can just carry on. I think it's very, very important to, to reassure people and because we don't want an anxious patient on our couch, do we? We want them to enjoy the treatment.
We do, and we want anxiety. And anxiety in itself can, stop the treatment working as well as it can do. So the more relaxed we can get somebody, the better the treatment, I usually find.
Of course, and can you talk to us, Jane, as well? Can you explain when you would use cooler water and when you would use warmer water during a colonic?
Yeah, sure. So sometimes you've heard Linda mention a lazy bowel, which we see quite a lot in our profession. So what we do is cool the water down, and what that does is, because your bowel at the end of the day is a muscle, it needs the kind of movement, the peristaltic movement. So the cooler water,
contraction and relaxation,
distension and contraction. So the cooler water kicks your bowel into action and gets that peristaltic action moving better.
It like shocks it, wakes it up, doesn't it?
A quick shock. With the warmer water, we tend to use that for people, particularly IBS clients, because there's a lot of cramping going on usually in the background with IBS. So we try and keep the water nice and warm. And also, if somebody's got the opposite problem, if they've got a lot of diarrhea or loose stool, we'll then keep them warm as well, just to try and relax the bowel down a little bit. Along with, if your therapist is herbally trained, we use the proper herbs to go along to things like chamomile, licorice fennel, just to relax the bowel. And the water temperature is an important part of it, I really find anyway.
Oh yes, it's crucial. And you always start a colonic off with warm water, don't you? And then you see how the bowel reacts to the water, and then you determine whether or not you need to cool it down or maybe warm it up a little bit more.
That's right. And there is strict levels of temperature that we have to keep between. So you won't be scalded or you won't be frozen. There are strict levels, and we've got 2 digital thermometers that we're checking at all time. So you're in perfectly safe hands. But obviously we're highly trained. We know what we're doing.
Yeah, I think experienced colon hydrotherapists can know, they know the temperature of the water just by feeling the water going through the tubing as well, or feeling that. I used to put my hand on the tank. But like you, I had 2 temperature gauges as well. Right, so for people who have never had a colonic before, Jane, I think it would be good if we could just briefly explain the whole procedure. So from when someone walks into your treatment room, right, you get them to complete the health questionnaire. You go through that with them.
That's right.
But and then you determine whether or not they're suitable to have colon hydrotherapy treatment. And if they are, then what happens?
So we get you changed first of all. Modesty is protected at all times. So one of the things when I first went to Linda, my first treatment, was I was panicking because I thought I'd just be lying there with nothing on, and that was what really frightened me. So you're all covered at all times. The only time, I know it's funny, isn't it, Linda, what we worry about?
I know, but Jane, well, it is, but Jane, I don't know if this has happened to you in your clinic, but I mean, men, what are they like, men?
I know.
Right, go in the toilet and just take off your underpants and your trousers. You can leave your shirt or your t-shirt on and wrap this towel around you and come out. And what do they do? They take everything off, don't they?
Yeah, they do.
I think because they're a bit nervous, they're not listening properly.
No, they're not. But we're used to it, aren't we? We've seen it all, so we're fine. We're fine. But we just get you changed in the toilet. We have very high hygiene levels, obviously, and with COVID, it's accelerated anyway. So everything is sterile and disinfected. So then we will get you onto the couch, and we like to have a little palpate of the area, have a little feel of your tummy, and just see what we can feel. We do a bit of percussion, have a little tap around your tummy, see if we can hear the gas pockets in there, which most people have got them, if not all. And then we get you onto your left-hand side. Now that's the bit when we insert the speculum. Now it takes a second, and it's not painful. It just feels a bit peculiar.
Sorry, Jane, can I just stop you there, because there's something really important, isn't there, here that we need to clarify. If you've got a new client in, before you insert the speculum, you always need to do a rectal exam.
We do.
A digital one. I mean, I used to use that finger. I don't know which finger I use, but I used to use that finger. And it's important to do a quick sweep of the rectum to ensure there are no obstructions before you put the speculum in. And also, it just gives the rectum a little bit of a stretch before you insert the speculum as well.
It is, and it really lubricates the area before you pop it in as well. So yes, that's just on the first treatment. Sorry, I missed that, Linda. Sorry. So yeah, we do a quick check, and like Linda says, it just gives us extra information for the treatment when we pop the speculum in. So we'll pop that in, and I always leave people on their side for half a tank, just to see how, if they've been to the toilet that morning, how well they've emptied. If they've not, then it will get that descending colon cleared first, and then I'll turn people onto their back. Now when you say onto your back, I've had a few people, really, onto my back. They think you turn them over onto the tummies, but we turn you onto your back. And we do, I mean, every therapist is different. I do quite a lot of massage during the treatment. There's other therapists who might not do that much unless you need it. But
I used to do a lot as well. And I think maybe it's because we are ex-remedial massage therapists. And also, when I went to study at the Viva May Clinic in Austria, the doctors there who I trained with, they were very keen on manual abdominal treatment, manual abdominal massage, in helping to move the stools and the gases.
Definitely. I find
personally, I think it's a very important part of the treatment, Jane.
Yeah, I do. So yeah, I do quite a lot of massage. So yeah, we get the water running, and like Linda said earlier, I always stipulate, if you know somebody really feels like they want to go to the toilet or they're a bit uncomfortable, let me know. We can get you off on the toilet and then get you back on.
Lots of reassurance, yes.
Exactly. And we're all, you know, it's the unknown at the end of the day. We don't know what it's going to feel like on our first treatment. I was the same. I was petrified before my first one. And at the end of it, I lay there and I thought, what was all that fuss about? You know, and I wouldn't be without it now. I'll have it the rest of my life. So yeah, it's a really good, gentle kind of treatment. At the end, we can tell where we are within your bowel as to what is coming out. So we can see from the formed stool down the left-hand side, right round to the quite loose food fibres seen coming through from the small intestine on the right-hand side. So we know more or less roughly at any time where we are within your colon. Then at the end, it's just really onto the toilet. Don't be worried about when we take the speculum out. Everything closes behind.
That's right. There's no mess. There's no odour, is there?
No.
It's closed, all contained.
It is. It all goes into the main waste pipe. It's all hygienically disposed of. And like Linda says, there's no smell or no mess made. And yeah, you're just free then to get onto the toilet. Take as long as you need. We do have a step in the toilet. I think they're called the squatty potties. What they're called. So we do have those. We like you to get your feet up off the floor, because it really is helpful to get your knees in line with your hips, lean slightly forward to help the bowel take that extra kink out and help the bowel movement move. So yeah, it's nothing.
So instead of the rectum sort of being like that, a kink, when you lift your feet off the floor, it kind of straightens out, so it's easier to defecate, isn't it?
Defecate, yeah, it does, and it makes a big difference. I don't know if you were there, Linda, but we had some advanced bowel nurses from the NHS come a few years ago, and they were saying that 80% of the people they get referred to them, once they put them on the right position on the toilet, the problem goes.
Yeah.
So it's so important, you know, to get that position right.
Yes, and to teach children as well, because so many children suffer with constipation.
They do.
Such a problem.
Yeah.
Right. Did you want to add anything else there, Jane? I think you've described that really, really well.
I think that's about.
Yeah. Oh, so when would you use herbs? When would you do a probiotic implant? When would you do a coffee enema?
So with herbs, I'm a bit like Linda. When Linda practiced, I'm really for the herbs. So I tend to use it on all of mine, unless somebody stipulates, no, I don't want them. I will use, you know, even if it's just a gentle fennel and licorice mix, which we use gallons of, don't we, Linda?
Oh, I used to use gallons of that. I did. And I love the smell of it. Oh, I miss that smell.
I know. And fennel.
I'll have a sniff when I come to your clinic.
Oh. So fennel and licorice really help gassy, constipated bowels. So I tend to use it in every treatment unless there is something contraindicated or people have got an allergy or something like that, or they say wish that they don't want them. With the probiotic implants, which is we implant with a catheter straight back into the bowel afterwards, and we
this
leave.
Is at the end of the colonic, isn't it, Jane? The end of the colonic.
Yeah.
So when they've been on the toilet and they've emptied, you get them back on the couch and you do
That's
the probiotic
right.
implant with the catheter. Yes.
Yeah, that's right. So we'll actually syringe the probiotic implant through a catheter back into the bowel, turn you over onto your back, make you nice and warm, and just let you relax for 10 to 15 minutes. And that is really helpful if you have been on a course of antibiotics, if you're really gassy and bloated in there. It can be quite helpful in quite a lot of cases, really. Some people
after a colonic, sorry Jane, some people after a colonic, they do like to take a probiotic orally as well, don't they?
They do. They like to, and it's good to boost your good bacteria after a treatment.
Well, you know me, Jane, I think everybody should be taking, I think probiotics should be in the water supply so that everybody gets a dose of probiotics.
Yeah, it should definitely. It's just so important to take the probiotics. So, you know, just adding that extra treatment where we can get the probiotics straight into the bowel really helps. And then, like Linda said, carry on with the orally taken probiotic as well. So yeah, that comes in very handy. And coffee enemas are really good for a detox. So they're supposed to, I read somewhere that they're 600% better than any other detox that you can do. And they really help. Yeah, and they really help if you're taking a lot of medications, or if you've, like over Christmas and New Year, we get a lot of people in January where they've overeaten and overdrank. Again, if you've been on the cancer protocols, if you've been on a cycle of chemotherapy, we can give, providing obviously where the chemotherapy, where the cancer is.
Yes.
We can do a coffee enema and a colonic up 2 days after a chemotherapy cycle, just to help those nasty side effects that you do get with chemotherapy.
Yes. Well, I think with the coffee enema, it's the cofestrol in the coffee. It's the cofestrol is taken up by the hemorrhoidal veins just inside the rectum.
It is.
It's transported to the liver, and it acts on the liver. It doesn't act on the bowel, does it? The coffee enema. It acts on.
Yes. Yeah. It gets taken, like you say, through the portal flow, through to the liver.
Yes.
And the active ingredient, the palmitic acid, actually will grab on any of the toxins, anything that's in there that shouldn't be, and flush it out.
Yes, into the small intestine and then through.
That's right.
Exiting through, the rectum.
It.
It's amazing, isn't it?
It is. So we can do with just so much more than just a quick cleanse, a quick detox.
Well, yeah, and you just reminded me as well, you know, colon hydrotherapists, they are just so much more than helping to clear out your bowels.
It is.
I don't think
is.
people realise the level of training that many
No.
colon hydrotherapists
No.
have to go through. Like with myself and with you, we were trained at postgraduate level, and so it's not just about cleansing your bowel. You can also give, dietary advice, lifestyle advice, advice on supplements and herbs, things like
Definitely.
that. There's so much more to a colon hydrotherapy.
There is. And
Right,
just listening to people sometimes as well. They just want you to listen and, and speak back to them. I've many a time had ladies in tears in here because they've just not been able to speak to somebody about their problems, and it's all bottled up inside. And bowel problems, that's the thing that they struggle. They've got nobody to talk to about it.
Yeah, huge. Do you think that's through embarrassment then, Jane?
I think so. I think a lot of the time it's embarrassment. I had a lady in yesterday, and her mother-in-law won't go to the doctors even though she's getting a bit of bleeding because you just don't talk about it, and she's in her 80s. She will not go to the doctors, and because she's embarrassed.
A red flag for bowel cancer.
Exactly.
It might be just a polyp. It might be a hemorrhoid.
Well, that's it. But it's just the embarrassment of talking to even though the doctors are dealing with it a lot, like ourselves. You need to go and get it checked out.
Yes. Oh, well, let's carry on with some more questions. Can I have the treatment if I'm pregnant?
No. In one word, no, we can't. Not unless, they say we can treat if you've got a doctor's letter, but I think there's other ways of really dealing with that. I wouldn't feel confident in treating somebody, a lady, if she was pregnant.
No, I wouldn't do it either. I think years ago it was a relative contraindication, but since then the colonic associations have got together and decided that it is an absolute contraindication now.
Definitely.
And there are other ways to. And usually it's because they're constipated, isn't it, that they want a colonic, Jane?
It is, and it happens quite a lot with ladies who are expecting, unfortunately. But the only way,
iron tablets,
the old iron tablets, definitely. But we'd rather play it safe and go to your GP.
Unfortunately, they can't even take laxatives, can they, if they're pregnant? No, certainly in the first few months of pregnancy.
So just have to be so careful.
If they're constipated and pregnant, then ladies, go and see your GP or talk to your midwife. Right. Oh. Right. This often comes up, is a colonic.
It does. It does come up a lot. I don't think it's not painful. It just feels a bit peculiar. Again, what we say is the more that you can relax and go with the flow, the better it is. You do get used to the feeling. It is a bit of a wake up call when it first starts, and you think, oh, But the more
it's that pressure. It's that pressure, isn't it? It feels a bit weird because you think you should be sitting on the toilet when you can feel that pressure.
Exactly.
You just got to let it go. I say, just let it go. Just relax.
Yeah.
Don't push.
No.
Just allow it to release.
It is. And I always say to my clients, because you're lying down, you're in front of a stranger who you hardly know. It's completely against what we used to when we're going to the toilet. So it is that a little bit. The more we can talk to them and get them to relax, the better it is. But I wouldn't say it's painful at all. And the insertion
I have never had a painful colonic. Never ever. Yes, there have been times when I felt the pressure, and when I've been to see you sometimes, I think maybe just on one occasion, I think I've said to you, "Oh, Jane, I've had enough now. Can we just finish?"
Get on the toilet.
Yeah, can I just go and sit on the loo and finish now? Because we've had some really good releases, Jane, and it's felt so much better. I thought, well, I've just had enough now.
Yeah. And well, that's good. That's what we want. We want clients to talk to us. It's got to be mutually beneficial for them. And we don't want them to feel uncomfortable. We want them to feel okay with it all. So,
oh, well, this is a good one, isn't it, Jane? I think having water pumped into your bowels is unnatural and unnecessary.
No.
Okay. What do you think to that?
No, definitely not. I'd never be without my colonic, never. I mean, all the water is filtered. It's nice and warm. We have the filters changed regularly. We have it all documented for the professional association. So if they check on us regularly, if they want to see our records, they're all there. It's not unnatural at all. I mean, I've had people who we're like a last resort. They've tried everything else.
I know.
And they come along and they'll say, why didn't I have this done years ago? And it's pure fear. I don't think it's completely unneeded. Obviously not seeing the clientele that I see, and people wouldn't be without it.
I know. Well, you know why why I raised this question here is because a few years ago I was at a health conference. We had a stand there. The Association of Registered Colon Hydrotherapists had a stand, and I was there, giving leaflets out and, talking to people about modern naturopathic colon hydrotherapy. And this woman walked up to me and she says, I think having water pumped into your bowels is completely unnatural. Why would you need to do it? Oh, well, you can imagine, Jane, the hairs on the back of my neck stood up. And I said to her, I said, you know what I think is unnatural? Having to have bits of your bowel removed and then having to, wear a bag, a colostomy bag that collects all your poo for the rest of your life. To me, that's completely unnatural and in many cases completely unnecessary if you can get to a colon hydrotherapist.
Yeah. Oh, definitely. I agree.
Diverticular disease and diverticulitis that is often caused by chronic constipation. If that constipation can be better managed by having periodic colon hydrotherapy treatments, then they wouldn't have those nasty diverticulitis flare-ups. They'd be at less risk of having them anyway.
Exactly. And years ago, you'll probably remember, Linda, if it hadn't been for Linda, we would have lost my mother-in-law sooner than we actually did, because she had a bowel blockage. And this was before I did colonics, and I rang Linda on a Sunday morning because she was actually bringing up fecal matter because it had got nowhere to go. So she was being sick with poo. And I rang Linda and she said, get her to the hospital now. Don't wait for an ambulance to get her down there.
Yes.
And she ended up having a stoma, having a bowel removed. And that was purely through it not being managed properly. Yes. And if my mother-in-law had regular colonics, she'd still be here today. Yeah. We kept her for a few other, she managed to survive a few more years.
She lived with you, didn't she, Jane, your mum-in-law?
Pardon?
She lived with you, didn't she?
She did. Yeah. But we could have lost her that day if it hadn't been for Linda, and if she'd have had colonics and looked after her bowel, she would have been here today, definitely.
And this happens more often than people realise, bowel blockages through constipation and people actually vomiting feces. I tell people and they look at me aghast, no, that's not possible, surely.
Yeah.
Well, yes. If it can't come out that end, it's got to come out that end.
The top end. So, yeah.
Right. So, someone said a colonic makes the bowel lazy. No. It's just the opposite effect, actually.
No. Like we were saying, it's a muscle at the end of the day. It needs that exercise. It needs the contraction and the other one, I can't remember what it is, dilation and contraction.
Yes.
To get it going. So, we use colonics along with supplementation to get your bowel retrained, to get it moving. So my bowel's very lazy. I know Linda's suffers with the same as me.
I do.
And I could go weeks without going to the toilet before I had colonics. I go daily now. Yes. That's not made my bowel lazy at all. It takes time. It's not going to be an overnight thing. But our colon needs exercise. It needs the contraction and the dilation to get it going.
Yes.
So no, it doesn't make your bowel lazy.
No, like you say, it exercises the bowel from the inside out. We've got loads more questions. I normally only speak for about an hour. I don't know how you are for time, Jane. What time do you start?
I'm fine.
Are you okay? Right, because we've got so much more to get through, so we may as well just carry on. Someone is asking, hi Stephanie, will I be able to watch this video again on replay? Stephanie, it will remain on the Just for Tummies Facebook page, so you can watch it anytime. But we also send it out in a newsletter, usually a week after the video, the live video. So if you get our newsletters, the Just for Tummies newsletters, you will get the link in a newsletter sometime next week. If you don't get them, go on the Just for Tummies website. At the bottom, scroll down to the bottom, just above the footer, you can sign up to get our newsletters. There are a few people asking. Oh, well, we've covered this one, haven't we, Jane? How long do I need to allow for the first appointment?
Yeah.
It is about an hour and a half, isn't it?
About an hour and a half, 90 minutes, yeah. Yeah.
And another, I had 2 done, felt great afterwards. Fantastic.
That's brilliant.
Oh. Hi, Louise. Are you still watching?
Hi, Louise.
Louise and I go way back. We used to work in Yorkshire Bank together many moons ago. Jane was absolutely brilliant. Highly recommended. Hope to see you soon, Jane. Oh, you've got your colonoscopy. Well done, Louise. On Saturday.
That's sorted, Louise.
Yes. Yeah. Well, then she'll have a better idea what's going on, won't she? She'll be able to rule certain things out.
Yeah.
Right. Let's have a look. More questions. Can a colonic? We haven't even touched on IBS yet, have we?
Oh, sorry.
Shall we just do that now? Because when I was in clinical practice, with colon hydrotherapy, the majority of my clients had IBS. It was either IBS, with bloating and constipation. Do you find the same?
Oh, I do. I'd say 98% of people I see are constipation and bloating, definitely. Yeah. And some abdominal pain as well.
Yes, cramping. Yes, yeah. So really, I mean, when it comes to IBS, irritable bowel syndrome, it's just a label, isn't it?
It is.
It's not even a disease. It's a syndrome. It's a collection of symptoms, and doctors will refer people for, they'll have blood tests, they'll go for scans and X-rays. But when everything else has been ruled out, such as celiac disease, inflammatory bowel disease, bowel cancer, and gynae cancers, because they share similar symptoms to IBS, of course, then the doctor doesn't really know what to do with the patient other than prescribe drugs to try and minimize their symptoms. And they might be laxatives, motility drugs, or what else?
Mebeverin, things like that for cramping.
Antispasmodics, or even antidepressants in an attempt to reduce the symptoms. But they're just trying to manage the symptoms. They're not looking at the root cause of IBS anyway. And I have an issue with that, because we have a pretty good idea what causes IBS anyway, some of the causes. But can you explain how colon hydrotherapy helps to reduce the symptoms of IBS, in particular constipation, cramps,
definitely,
bloating?
Definitely. So what we usually see during a colon hydrotherapy is lots of excess gas in there, big pockets of gas as well that can actually stop the transit of the bowel movement.
Yeah.
And also excess gas can put your bowel into spasm. So it's really important to get on top of that gas, get all the excess old waste out, and get that bowel relaxed. I mean, I have a GP that comes regularly for treatments, and he said to me a couple of months ago, Jane, he says, I feel very humbled, because he always has the mirror up to see what's coming out. And he said, it makes me humbled, he says, because I know whatever drugs I give to anybody for their tummy, I can't get out what you can get out. And he says, and it makes me feel very humbled. And I thought that was good coming from a GP from the NHS.
Yeah, absolutely.
And we do, and we do get medics coming in, we do get nurses, and Linda's the same when Linda was in practice. So yeah, I think personally the gas is the main problem. with it all.
Oh yes, certainly when, you know, regarding the cramps, the pain,
Yeah,
and helping prevent the you know, the stool from moving through.
around. Yeah, and a lazy bowel, you give a low peristaltic action, low muscle action as well. It's a double whammy.
Yes,
They've got
yes.
no chance of getting it out on their own. You know,
So
it's supposed to be
just by introducing that warm filtered water from a
yeah,
colonic, it
yeah,
helps release all of that trapped gas, doesn't
it
it?
does.
It
It
relaxes
does.
the bowel. It helps, you know, move any impacted waste as well, and then everything relaxes, doesn't it?
It does. It
Because
does.
when they're full of gas, you know, it pushes up into the diaphragm and the lungs, so everything feels tight and uncomfortable,
It
and it
does.
can affect your breathing, can't it? I mean, I
It
remember
can.
having people in the clinic where they couldn't inhale properly because
That's
and
right.
exhale properly because the lungs were fixated because they were so full of
That's
abdominal, you know,
that's
uncomfortable
it.
abdominal gas.
That's right. And we get, because it also pushes on the stomach, it can push acid back up. So you
Exactly.
get acid
Yes.
reflux.
Yes.
Everything really is around that bowel area. Once we
Yeah.
get that working better and get it emptied, we see people are so much better with things. They really are.
It's amazing, Jane. It's amazing that you can have somebody with IBS walk into your clinic, maybe IBS-C, where constipation is their predominant symptom, and they're bloated. I mean, I remember one lady that came to see me. Honestly, she looked 9 months pregnant. She'd not had a bowel movement in over a week. She was in so much pain and discomfort. Laxatives hadn't touched it, right?
No.
And so, you know, obviously a very conservative colonic,
Yeah.
short fills, very warm water, not a lot of abdominal massage because she was quite, you know, tender.
Quite
And
tender. Yeah.
it was just non-stop, Jane, for about 45 minutes, emptying her. And we weighed her before the colonic, and then we weighed her afterwards. And she lost about 7-8 pounds in fecal matter during that one colonic. And afterwards, and when she was lying on the couch, I was observing her face, because when she walked in, she just looked grey.
Yeah.
And I was observing her face, and I could see as all the feces was releasing, the colour come back into her face and the sparkle come back into her eyes. And after the colonic, all the pain had gone. She was flat. She felt like a different woman. So again, don't let anybody tell me that colon hydrotherapy doesn't help people.
No. And it's miraculous. It's like straight away somebody feels better.
Yes,
you know, and I've seen the same. I've seen people come in grey colour and come out of the toilet and they're rosy again, the colours come back.
And smiling.
Yeah. You know, it's just such a effective treatment. It really is.
If more doctors knew about the benefits of modern naturopathic colon hydrotherapy, then, and if they could refer more people, you know, to colon hydrotherapists, we'd see a lot fewer cases of IBS, wouldn't we? And constipation. I mean, when it, you know, colon hydrotherapy comes into its own when helping to relieve people who are chronically constipated. Like
Definitely.
I say, nothing else works as well as a colon hydrotherapy treatment.
That's
but
right.
we're trying to educate our GPs, don't we?
It is. And the doctors only can't refer because we've got no scientific background on it.
I know it's difficult for them because they can only go by, you know, NICE, can't they?
What they're told.
The National Institutes for Clinical Excellence.
But saying that, you know, I have had quite a lot more recently of doctors saying to patients, well, you could try colon hydrotherapy. They are coming round very slowly to it.
I can't recommend it personally, but you might like to look into it or investigate it.
Exactly. And it's just because it's an ancient treatment, none of the scientific scientific testing has never been done on it, because it's been there since 1500 BC, you know.
But just because there's no research to prove that it works, doesn't mean it doesn't work.
No, exactly. Well, we know it works. Our clients know it works.
Our clients know it works, and that's all that matters really at the end of the day. I've got a lady that's asked a question, Jane. Oh, it's Stephanie again. I have colitis. Will this help? Do you want to take this one, Jane?
Yeah, it depends what kind of colitis it is. If it's ulcerative, we can't treat it while it's in a flare-up. It has to be in remission. But then again, it's not always the best thing for ulcerative colitis. Sometimes dietary changes, supplementation.
Absolutely, yes,
can
I
work.
agree. With
Yeah.
ulcerative colitis, it's an inflammatory bowel disease like Crohn's disease, not quite as serious as Crohn's disease, because
No.
ulcerative colitis just affects the large bowel.
Yeah.
But and usually with ulcerative colitis, one of the symptoms is diarrhea, although some UC sufferers do get constipated as well. And for me, it's diet, it's supplements, it's probiotics, and it's omega-3 essential fatty acids. So it's our live bacteria, our Just for Tummies live bacteria, and our Just for Tummies omega-3 capsules. So Stephanie, if you want some advice, just drop me a message after this live.
Yeah, it does depend on what kind of colitis it is.
Interestingly enough, I've been reading some article recently about microscopic colitis.
All right.
And that many people are being diagnosed with IBS when in actual fact they've got microscopic colitis, which is an inflammatory bowel disorder. But even with microscopic colitis, people have contacted me about it, and be very well managed and reversed with diet, lifestyle, and target supplements.
Yeah, definitely.
Right, so I've just got hi Louise, thank you for watching. Where would I start trying to fix my digestive system? I've had an endoscopy and colonoscopy, no issues. I was told it's IBS. I get a lot of bloating and pain. I'm sure I get acid reflux each morning, but not confirmed. So, well, Louise, if you were my client, I'd want to dig a bit deeper into your IBS. I'd want to know when your IBS, what triggered it initially. I'd want to know your antibiotic history. I'd want to know if you'd ever had any gut infections like food poisoning. I'd want to know, for example, with the bloating, is it worse after you've eaten food, the bloating and the pain? I'd want to know if one of your symptoms is constipation as well. I'd want to know if you're taking any medication, because if you're getting acid reflux, have you been to see your GP? Are you taking a PPI? If you're taking a PPI, if you've taken one long term, then this can contribute to bloating and cramp, because regular use of PPIs, can cause an imbalance in your gut bacteria. So I'd want to know some more information, Louise, but I can assure you there's a lot can be done with colon hydrotherapy, diet, lifestyle advice, and supplements to completely resolve the IBS. So don't let anybody ever tell you that there's no cure for IBS, because they're wrong. Right, Anne. Oh, hi. Hi, Anne. Thanks for watching, Anne. Right, so back to more questions. So I think we've pretty. I mean, when it comes to colon hydrotherapy and IBS, for me, it's kind of a no-brainer, Jane. It's such an effective, safe treatment for IBS symptoms. I can't really say any more about it. I mean, I literally treated tens of thousands of people with IBS using colon hydrotherapy with fantastic results.
Yeah.
And I would just say to people, look, give it a try. Don't believe all that you read. And especially on Google, find and when you want to look for a colon hydrotherapist, ensure that that they're registered, they're regulated. I am not in clinical practice anymore, but I am still a member of the Association of Registered Colon Hydrotherapists, as is Jane. And I will share their website above this video when we're finished. And on the we call it Arch for short, don't we, Jane?
We do.
On the Arch website, you can click on a page and find a therapist, and you'll be able to find a therapist in your area.
I mean, if anybody wants any help, just get in touch with myself to find a therapist near you.
Yes, you're on the committee, of course, Jane. I forgot.
Yeah, I sit on the executive committee.
Yes.
So, I can guarantee that any of our members are really highly trained. They will look after you like nobody else. So,
and they're all regulated by the Complementary Natural Healthcare Council, which is a independent regulated body, isn't it?
Yes, it is. They were set up originally by the government to keep an eye on all the complementary therapists, really, make sure they were all properly trained.
Yes, that's
So
right.
the CNHC is who we verify all our members to, and they have to be trained up to this high standard. They have to have a medical or a CAMS background.
When you say you mean complementary therapy, don't you?
A complementary therapist,
in a substantial complementary
yeah,
therapy discipline.
yeah,
Yes,
definitely. And when they are actually taken into the Association of Registered Colon Hydrotherapists, they have to go through a strict membership criteria. They're all vetted. We go through their training backgrounds. If they've not trained with one of our affiliated schools, they are interviewed. They have to jump through quite a lot of hoops, actually. You know, that's it.
Yeah, I have still got my training manuals from the National College of Colon Hydrotherapy, Part 1 and Part 2, and they're fantastic manuals. These training manuals are full of, you know, great information, and I still refer back to them now.
Yeah. Oh, I've always got them on. Yeah, I have. Right. So yeah, if anybody wants to know if any registered and regulated colon hydrotherapists, please just drop me a line and I will tell you who your nearest registered therapist is.
Yes, and I'm the same. Contact me as well. I'm always signposting people to colon hydrotherapists.
Definitely.
Right, a few more questions then, and this one always crops up, doesn't it?
It's quite a common one. It's impossible for a highly trained colon hydrotherapist to perforate a bowel. I was telling Linda the other day that we had a bit of a horror story come in from one of my clients where a relative had been somewhere else and they'd just pumped her full of water and could see her abdominals rising, which is very, very dangerous. Obviously not trained to the standard where we're supposed to be, and it's highly unregulated out there. So they can perforate a bowel, but if your therapist is highly trained and registered and regulated, you are in perfectly safe hands.
I think there are two ways they can actually perforate a bowel, isn't there?
Yeah.
The speculum insertion, if they're not doing that correctly.
Yeah.
And obviously, if they are putting in too much water.
That's right.
And of course, it is so very important that when you have a new client and you are completing the health questionnaire and you're taking the medical history, then, for example, you want to know if they've been taking steroids.
Yes.
If they're on steroid medication, they've been taking steroids long term, because we know that steroids can thin tissues, including internal tissues and the bowel, which is why the health questionnaire is such an important part of the process.
It is. Yes, definitely.
But when it comes to bowel, obviously, if you've got a well-trained colon hydrotherapist carrying out a colonic. And when it comes to the issue of bowel perforation, it just can't happen. If they've done all their checks and procedures, it can't happen. And because there's only about 1.5 to 2 pounds per square inch of pressure applied to the bowel wall during the colonic, and when you're having a bowel movement, there's a lot more pressure applied when you're having a bowel movement. So
true.
Right, so carrying on then. Does the colonic wash out the friendly bacteria in the bowel?
This is a big one. This is one that gets people and that's been falsely packed around. So all we're washing out during the colonic is all the pathogenic bacteria, anything that is floating in the lumen, which is the whole bit of the colon. All of the beneficial bacteria is actually impacted into your bowel walls. So there's no way we can wash that out. If you think about it, every time you had a bowel movement, it'll clear all your bacteria out. You know, so the important strains are actually impacted into your bowel wall. So it gives us a good starting point again, getting all the pathogenic stuff out. We get you good probiotics, lots of good vegetables, a little bit of fruit, not as important, to make that recolonize and get that good strong microbiome level in there. It's so important.
Yes, yeah. So the bowel, well, a colon hydrotherapy will only wash out, like you say, what's loose within the bowel, and it will come out with your stool anyway when you sat on the toilet. The colonic water cannot penetrate the biofilm that lines the bowel wall, where the nuclei of the bacteria is deeply embedded. So so that's right. I was going to say something else and I can't remember. It's gone. Never mind. It might come back to me. So we touched on a couple of contraindications, didn't we? Like steroids, for example. Yes. But when it comes to colon hydrotherapy, we have absolute contraindications where absolutely no, you can't have a colon hydrotherapy treatment. But we also have relative contraindications where, depending upon the circumstances and depending upon the colon hydrotherapist, he or she can decide whether or not they want to proceed. So are you able to give some examples of absolute contraindications, Jane, and relative ones?
Yeah, so absolute, like you said, earlier pregnancy, we've got high blood pressure. If it's over a certain pressure, we can't treat you. What else have we got? We've got 50% function of kidney function. That's quite an important one. All the inflammatory bowel diseases, recent abdominal surgery. There's quite a long list actually, where the relative contraindications are, maybe things like, I don't know, this is quite a difficult one because I do see them quite a lot actually.
Well, I've got a list here, Jane. I've got some absolute contraindications like abdominal hernia, obviously cancer of the colon or rectum, children under the age of 16, congestive heart disease, diverticulitis. Good one, isn't it? We can treat people who have got diverticular disease, but not when it's in flare up. I could talk for ages about diverticular disease and diverticulitis and how poorly it's managed in primary and secondary care with these poor people, having flare-ups and being put on antibiotics or even ending up in hospital. It can be much better managed with diverticular disease without getting those awful flare-ups.
It is.
Hemorrhoids, inflamed hemorrhoids. I mean, nobody wants to go near anyone with a speculum that have got inflamed hemorrhoids.
No, it'd be too painful for them as well.
And that's why, of course, it's important to do the rectal exam, isn't it? To ensure we haven't got any internal hemorrhoids. Pregnancy, rectal bleeding, severe anemia, renal insufficiency, so poor kidney function. And then the relative ones, hypertension, it's okay if it's controlled. Diabetes, again, okay if it's controlled. Diverticulosis, diverticular disease, okay if more than 3 months after a flare-up.
That's right.
Inguinal hernias, tight sphincter, severe underweight or eating disorders. And do you ever get people contact you who suffer with eating disorders that are, that are wanting colonics to help control?
I've had a few over the years, but mostly, I mean, they say if you do treat them, to work with their team who they're working with at the hospital. I would really not like to treat anybody who's suffering with an eating disorder at that time. If I know that they've got an eating disorder, I would put them off and send them elsewhere for treatment. I
was the same, Jane. I would never take anyone on with certainly anorexia.
No.
In fact, I think in all my years as a colon hydrotherapist, I only had one inquiry from a girl who had anorexia. Right, so can the colonic water get into the small intestine and make my SIBO worse? I'll let you answer that, Jane.
No, I mean, we've got something called the ileocecal valve, which actually keeps the large intestine away from the small intestine. So it's like a one-way valve. The only time maybe is if you've got a dysfunction of the ileocecal. Would you agree with that, Linda?
Yes, yes, I would. I mean, for me, Jane, if someone's got SIBO, they absolutely do need colon hydrotherapy,
Yeah,
because
yeah.
they've got all that sort of bacteria that shouldn't be in the small
That shouldn't
intestine,
be. Yeah, yeah.
creating lots of painful, crampy gas. So the
Mm.
best thing they can do to relieve that is to have a colonic. Because
Yes.
once you've emptied the large bowel and you've relieved the pressure in the large bowel, then what is behind it in that 16 feet or so of small bowel can then
Empty
work
through.
its way through. So I think everyone who has SIBO as part of their treatment protocol should be having colonics anyway.
No, you're right. It does, and we see it time and time again when the large bowel is really distended and full. It doesn't allow the small intestine to move through properly.
Yeah, that's right. Yes, that's
So
right.
once we take the pressure out, everything moves much easier.
Yes.
So
And for me, when I was a colon hydrotherapist, I always wanted to get into that cecum, Jane. I always wanted to clear that cecum out.
we love to
Because
see a cecal flush.
we do love our cecal flushes. Did I tell you I used to put my cecal flushes into categories? Did I tell you?
No.
I can't remember if I ever told you, depending on how toxic they were, because the cecum, because it's kind of pouch shaped, a lot of material can get trapped in there. Bad bacteria and parasites, and lots of fulminating gases can get trapped in there. And you've obviously seen it many times, like I did, that when the cecum releases in some individuals, it's black, isn't it?
It
And
is.
you're holding the outlet pipe, aren't you, Jane? And it's black that's coming out, and you can feel the heat as well through the pipe. The heat of all that bacteria.
Yes, and the pressure
and the heat from all that bacterial activity. So I used to put them into categories of a normal flush, a toxic flush, a witch's brew, and what was the other one? The fourth
Gates
one.
of hell.
Gates of hell. The gates of hell when it was really toxic. Yeah, I did tell you then. Yeah. Right. We've got some more questions. Just let me have a little look down my list. So we've covered the water. What about treatments? How many treatments? How do you advise on the number of treatments a person may need, Jane? I know it depends on their symptoms, their age maybe. So how do you do it?
Everybody's different. Like you say, we don't blanket judge everybody. Everybody's classed as a separate person. I always find at least 2 treatments quite close together is needed, if not 3. So it all depends how the treatment goes. If you're very impacted in there, we can tell if we've got right round to the cecal area or not. So if we can't get all the way round, which is very rare in one go on first treatment, we like you back within maybe 4 to 6 weeks or sooner if possible. Dependent on how that goes is whether and how soon after that you might need another one. So everybody's really individual. We don't just say, right, you're going to need 6 treatments.
No,
because not everybody does.
No, you can't possibly tell, can you?
No, you can't. You have to take everybody individual. The last thing we want is for you to have a treatment and then another treatment and another treatment, and you don't really need them.
No.
We need to get that bacteria nice and healthy.
With me, when I was in practice, I certainly when it came to IBS, I'd give them the first treatment, and they always felt much better just after that one treatment. And then I'd get them booked in for about 3-4 weeks as a follow-up, because I wanted to palpate the area. I wanted to see what material was coming out of the bowel. I wanted some feedback from them. How have you felt?
Exactly.
Have you taken on board any of the dietary lifestyle supplement advice that I've given you? And then after that second treatment, I'd probably book them in for about 3 months after that.
That's what I do, Linda.
Yeah.
It's I usually find at least 2's needed, and then put them on to 3 monthly like you. And then as they get better and improve, we wean them out. So
I think when it comes to constipation, a little bit different. It depends how severe the constipation is. It depends how well they're managing their constipation in between having a colonic. So with constipation, I sometimes used to see people on a monthly basis. if the constipation wasn't being managed very well. Because for me, you know, proper management of constipation is having a full volume, soft, easy to pass bowel movement every day.
Yes, that's right. I'm the same. You know, with constipation, it's a different matter, isn't it? And we need to keep them moving. We don't want them blocked.
No, we don't, because obviously with constipation, we know the risk factors. You know, with the increased risk of diverticular disease, bowel infections, perforations, and bowel cancer, of course.
Exactly. Yeah. So the longer it's stuck in your bowel, the more prone you're going to be to the bowel colorectal kind of problems and cancers. We don't want it in there.
Good. Not good at all. So let's have a look then. Oh, where can I find a therapist I can trust?
I would, go on, Linda.
Well, you know, it's, I mean, for me, I would go on a recommendation. If you know someone that's had a colonic with someone and they've been fine, then, you know, I would go by recommendation and check out the associations. I mean, for me, I know my association. I've been a member of the association for, I think, 18, 19 years now, the Association of Registered Colon Hydrotherapists. So I would, and I know many of the colon hydrotherapist members in that association, having been sat on the committee myself as well a few years ago. So I know these therapists, and I can vouch for them. Yeah. So it's either recommendation or it's contact one of the associations like Arch. There are other associations. There's RICTAT. What does that stand for? The Register of Integrative Colon Therapists and Trainers. And are there any more, Jane, that you're aware of?
There's IACT, isn't there? But
there's IACT,
that's not quite that's more an international one.
Is that the American Association?
Yeah.
But they do have members in, you know, in the UK.
Yes, they do have members. Yeah.
And are there any more that you're aware of?
There's the IPCH, which they have now amalgamated with Arch as well, the Association of Registered Colon Hydrotherapy. So I think they're the three main ones that you've mentioned now. But it's just so important.
Arch, RICTAT, and
IACT.
IACT, yes.
Yeah.
Okay,
but please make sure that your therapist is regulated and registered.
Yes.
It's just highly unregulated out there, and there's people with very minimal training and no medical background or CAMS backgrounds.
Well, any colon hydrotherapist worth their salt would be happy to show any client their certificates, wouldn't they?
Yeah.
The membership certificate, the association membership certificate, the certificate for their regulatory body, and their insurance certificate, of course.
That's right, definitely. So check any therapists out that you intend to contact. That's the main thing. Look at their background, look at their training.
Read the reviews if they've got reviews on their website or their Facebook page.
Yeah.
Ask to go down and have a look at the clinic. And I was always very happy for people, you know, to come and have a look, have an initial chat with me, with, you know, no obligation to book in.
No. I think if that person has got nothing to hide, then they'll be quite happy to have a chat with you.
Yeah. Absolutely. So I think our final question today is this. Oh no, we've covered that. And yes. Colon hydrotherapists can give dietary, lifestyle, and supplement information to help prevent symptoms from returning.
Yeah.
And there was someone said, where if I want to train in colon hydrotherapy, who do I contact? And it is, well, this is where I trained anyway. You can't see it on there, but I'll read it out. The National College of Colon Hydrotherapy, postgraduate colon hydrotherapy course. That's the one that I did.
Yeah,
run by Roger Gruce and is it still Abby as well? Abby Gruce,
yeah.
And they're based down in
Devon, in Woolacombe.
Devon, Woolacombe. Used to love going down there. Yeah. Right. So I can't think of anything else. I'm just going to double check that we've covered. Can you think of anything else, Jane? Anything that I've forgotten?
I can't think so, Linda. I think we've covered most things, haven't we?
Yeah, I'm just checking through the questions here that people have asked.
I'm glad people are so interested in it.
Oh, they are.
It's a good thing.
People are very, very interested in it. They don't always, I think, because of embarrassment, they don't maybe come forward, to ask questions. But
nothing to
I
be
know
embarrassed about.
Yeah, no, absolutely not. Absolutely not. Right. Sue, thank you for watching, Sue. Thank you so much for such an informative session, so helpful and reassuring on a lot of angles.
You're welcome, Sue.
Yeah. Daphne, do you know, Jane, have we got any therapists?
Yes, we've got a few. I think we've got 3 or 4 over there, but it just depends on whereabouts you are, Daphne. I mean, you can always contact Linda or myself, and we can have a look. And I can put you in touch with the therapists in Northern Ireland. Yes. But we need to really know whereabouts you are.
I think, generally speaking, colon hydrotherapists are as rare as hen's teeth in some areas.
Yeah,
and I think that's why colon hydrotherapists are so very, very busy, because there's only a few of them, but the need for them is so great.
Yes. Yeah, I agree.
Because certainly when it comes to IBS, when I first went into clinical practice 30 years ago, didn't really exist. Well, I mean, I did, but not like it does now, where we've got millions of people who have been diagnosed with IBS.
Exactly.
And then lots more people.
My GP who comes says, Jane, you'll never be out of work.
No colon hydrotherapies. As you know, I closed my clinic, Jane, because I just got so busy running Just for Tummies.
Yeah.
Plus we had a granddaughter that arrived, and I wanted to spend time with her. And I just decided after 30 years in clinical practice, I'd done my time, and honestly, I just loved being a colon hydrotherapist. I got such a lot of job satisfaction, and I was so delighted that you trained up to become a colon hydrotherapist, that I could then refer all of my clients to you, because I just knew that they'd be in safe hands with you.
Oh, bless you. No, I do. It's the best job in the world. And like you say, that job satisfaction and seeing people go out with a smile and relieved and
just reassuring them as well. Reassuring them, look, and saying, look, I can't see anything sinister here. It just looks like you've got trapped gas, or you've got a lazy bowel. I mean, obviously, if ever we did suspect anything sinister, Jane, then we'd refer them straight back to their GP.
Straight down.
And there has been times when I've even referred people straight down to A&E. For abdominal scans. So, but it's just about reassuring people and about educating them about how important bowel hygiene is, and how to manage IBS and constipation.
It is.
Really.
Definitely.
Nothing more than that.
No, and there's that many important systems within the bowel as well. You've got your lymphatic system, your immune system, your serotonin levels. It's just such an important bit of kit to look after.
Yeah. And, I'll just say this. I've been talking to a lady recently whose little girl, she's 3, she's suffering with, it's a little bit better now, the constipation, but she suffered with the most terrible constipation. And we know a lot of children suffer with constipation. Now, this little girl, who's 3 now, was born prematurely. And so when she was born, she was given prophylactic antibiotics. She also suffered with ear infections as a baby, so was given several courses of antibiotics. So, Jean, what caused the constipation?
Exactly.
The antibiotics just wiped out a beneficial gut bacteria, and we need that to help maintain healthy peristalsis.
We do.
And this mother was given no information about, the detrimental. I mean, obviously she needed antibiotics, of course she did, but about the detrimental impact of antibiotics and how to mitigate the side effects of them by taking an infant probiotic.
That's right. That's right. You know, and I've had a few clients from the Eastern European countries, and they were saying when they're put on a course of antibiotics, they're then prescribed a course of probiotics to
Yes.
follow on to get the good
Yes.
bacteria back in. Why don't we do that here? You
Yeah.
know, or at least give them the information.
Just give them the information, because
Yeah,
again we would see much fewer digestive and gut disorders.
we will.
And it's the same with acid reflux, you know, Jane. I've
Yeah,
found people that have had antibiotics, they suddenly develop acid reflux.
yeah,
Well, yes, I can understand that, because the antibiotics have probably caused some inflammation. Although the antibiotics are supposed to get through the stomach quickly into the gut, where they're supposed to work, but and be absorbed that way. But you know, antibiotics can cause this irritation in the lining of the
oh,
stomach
definitely.
that can then cause acid reflux. And they find that when they take probiotics, you know, the acid reflux calms down.
That's right. It's just so important.
Mm, mm.
Uh,
Well, Jane, we've gone a lot longer than I thought, but it's such a fascinating subject, isn't it?
it is.
And
It
I
is.
hope everyone on Tummy Talk who's been watching this, and on Facebook, not Facebook, the Tummy Talk Facebook group and YouTube, find it useful. And like I say, it gives them the confidence and the trust to approach a colon hydrotherapist. And I will be sending it out in a newsletter next week, and it will be on the Just for Tummies website as a blog under the health videos category as well. So Jane, I know how busy you are. Thank you so much for your precious time today. It's
Oh,
been
you're
absolutely
welcome.
fascinating, so enjoyable.
Yeah, it's
So
lovely to speak to you
yeah, you too, Jane,
and
and
get it
I'll be
out
seeing you
there.
soon. Okay,
All
thank you,
right.
Jane, and thank you everyone for listening and watching. Really hope this helped you today. Bye, Jane.
Thank you. Bye.
Bye. Thank you.
Bye.